Hello, everyone. I'm Whitney Murbaugh, and this is my case presentation on diabetes. So my patient's name was TB. He was a 68-year-old male. He came in with complaints of a sore on his bottom. He was diagnosed with diabetes about 12 years ago. He is non-compliant with checking his sugar as well as taking his insulin the way it is prescribed. He came in and told us that his average glucose was 110, but his A1C was in the 9 range. He said that he had a non-healing sore on his right buttocks. He'd been there about 3 weeks, but it was starting to open up and weep. One of the strange things in this case was that he lived in a house with his wife and his wife's ex-husband, who actually is the caregiver to him and his wife. So he was being cared for by his wife's ex-husband. He's wheelchair bound at baseline, and he's incontinent of both bowel and bladder. These are the medications that he takes daily or that he's supposed to take daily. Like I said, there's some non-compliance issues with him. As far as his past medical history, he had his tonsils removed, he had pneumonia and a femur fracture from an MVA, which is why he says he's wheelchair bound, but we actually aren't really sure why he can't get up and move. He is a diabetic, he has a history of depression, he has a history of PTSD. He did serve in the military, but was never deployed overseas. He has a history of hypertension and anxiety. He was hospitalized in 2018 with a left foot wound and in 2011 for chest pain. His family history is here, some diabetes, hypertension, obesity, alcoholism. His health maintenance, he's had a colonoscopy. Other than that, he really hasn't done any health maintenance. So he lives in a house with his ex-wife's husband, his wife, his wife's 2 children, and their family, so their kids. So there's a total of 11 people living in a 2-bedroom house at this time. He really is pretty sedentary. Obviously, he's wheelchair bound, so he watches movies and war movies. He doesn't know if there's carbon monoxide detectors or smoke detectors. There are smoke detectors. He doesn't wear a seatbelt in the car. He spent most of his military experience in California. He smokes a pack a day. He drinks alcohol daily, and he did have some past marijuana use, but not currently. All right, so as far as complaints, he really only complains of the sore on his butt. He said that he's not, there's no blood in his stool. He's not nauseous, but he is incontinent of stool and urine, so. He has some musculoskeletal issues, but nothing that is out of the ordinary. He has some weakness, and he was able to stand for us so that we could see the wound, but that's about it. He does have a history of depression, but feels that it's pretty stable currently. This is his objective data, so he's a little bit overweight. Blood pressure was okay. All right, so he's obese, disheveled, pretty poor hygiene, pretty poor dentation. As far as the wound, it was like a quarter-sized ulceration on his right buttocks. A little bit of drainage was noticed on his brief, but all of his skin was excoriated from the front to the back, just from the incontinence. He said that he doesn't know when he goes and he goes to bed at night and doesn't get up at all during the night. So, I mean, he sits in stool and urine for an extended period of time. His lungs were diminished, but they were clear. He has decreased range of motion and grips throughout. So as far as differential diagnosis, pressure ulcer, there was no tunneling, there was no necrosis that could be seen. And my second differential diagnosis was the incontinence, which could greatly impact skin integrity. Our plan for him was to continue dressing changes BID. His wife's ex-husband actually came in and learned how to do the dressing changes. We encouraged him to increase his activity and shift his weight. We ordered a gel chair pad for him. We made a referral to meet with the care manager in the office just to find out why he's not compliant with his medications and see if we can get his diabetes under control, see if they need some home care, any additional resources at home that we could help with. And a referral was made for a home care agency to go out and assess the home and see whether he'd be a candidate for some home care. Teaching included keeping the area clean and dry. Like I said, he counts on his wife's ex-husband to help with his bathing and stuff, so he said that might be a challenge. We encourage him to reposition every 2 hours, work on controlling his blood sugar, and to start taking his medications as prescribed and not skip any doses. And these are my references. And that is it. Thank you.